This is how you cross over from Israel to Gaza, and right now we're in no man's land.
Prime Minister, do you now regret when once asked what your favourite joke was, you replied, Nick Clegg? And Deputy Prime Minister, what do you think of that?
Mr. Trump, why should you be president? What makes you fit for the role? Is it just one big ego trip?
Thank you very much.
People aren't sure they can trust what you say. You say things and then it turns out that they're not quite what you said. I'm Andy Bell and I've been a journalist for over 30 years. In this podcast, How Did We Get Here?, I try to provide context and background to a big story in the news. In this edition, I talked to Jeremy Hunt, the longest serving health secretary of recent times. And just 12 months ago, he was in the runoff to become Prime Minister. Now he examines our handling of coronavirus from his position as chair of the Health and Social Care Select Committee. We talk about what's gone right and what's gone wrong, his worries about the approaching winter, and what he thinks of the man who beat him to the top job. Thanks very much for talking to us for this edition of How Did We Get Here? First of all, let's go for the big question. How do you rate the government's handling of the crisis?
Well, I think we've done some things incredibly well and we've got some things wrong. And if I start with the things we've done well, I think that it is an incredible achievement that not a single person was denied an intensive care bed at the height of the pandemic or a ventilator. And when you look at what happened in northern Italy and in New York, you can see that that was not a given. And it was a huge achievement to build those Nightingale hospitals, some of them in 10 days flat, and get an extra 20,000 additional doctors and nurses back from retirement into the NHS. So that was very positive. I think we can also see that the scientific advice the government received in January was wrong. And it's clear that the government scientific advisory committee, SAGE, did not offer ministers the choice of a South Korean track and trace. They were following the flu model rather than the SARS-MERS model. And that was a kind of groupthink, which I share some responsibility for because I was health secretary for 6 years and we made huge effort into our pandemic preparedness. But we were always preparing for pandemic flu.
There's quite a big statement. The scientific advice all the way back to January, or starting in what happened in January, was wrong. I mean, people are going to listen to that and say, oh, it's all very well to blame the scientists. What about the people in power?
Well, the people in power have responsibility for all government decisions, and they can't shirk those. And I can't shirk the things that I was responsible for when I was health secretary and foreign secretary. So the responsibility, of course, lies with the politicians. But what matters now in this situation that we're in the pandemic is that we have had a large number of avoidable deaths. You have that in any healthcare system at any time, not just in a pandemic. We have terrible issues where babies die on maternity units. In any country, these things happen, and the way you prevent them happening is by learning from mistakes. So the reason for talking about the scientific advice we had then is simply to make sure that looking forward, when we think about a second wave that could happen in the winter, that we get things absolutely right. And I think the mistake we made with the scientific advice is a mistake that anyone could have made. And I don't point any fingers at the scientists involved, who I think are exceptional individuals. A number of them I worked with myself when I was health secretary. But what would have helped in January is if the scientific advice to ministers from SAGE was published, because then scientists from up and down the country, brilliant minds like Professor Devi Sridhar at Edinburgh University, could have challenged the advice that was being given to ministers and said, why are you just modelling mitigated herd immunity and total lockdown? Why aren't you modelling the middle way of South Korean track and trace? Because they've had experience of MERS and SARS. The World Health Organization is saying that we should follow the MERS approach. And if we'd had that peer review earlier in January, I think we could have improved the quality of that advice.
Is it the case that within the scientific community there was not enough contesting of what became a kind of easy consensus that was then presented to the government. And again, ultimately, is that not the government's fault in the way the system had been set up?
Well, I think it's just wrong to point fingers. It's not helpful, because in a pandemic with a brand new virus, no one is going to get everything right first time. I certainly wouldn't have. I've been health secretary, and incidentally, I think Matt Hancock has done a tremendous job. But the reason for this groupthink was that I think that we have thought for many years pandemic equals flu. And that's because we've had H1N1, swine flu, Spanish flu. We've had experience of flu. We haven't really had direct experience of MERS, which originated in Saudi Arabia, or SARS, which originated in the Far East. And so the countries that did have that experience of SARS had a completely different mindset, which is that you have to find out who has the disease with widespread testing and isolate them really quickly. And the result of that mindset is that, for example, in Hong Kong, they haven't had a single death in a care home. In fact, they haven't had a single infection in a care home. In South Korea, very early on, they said to people who worked in care homes, we're going to pay you extra to move into your care home so that you are, in a bubble with your residents and you're not going to and from the community. That experience they had with SARS and MERS led them to a different approach, which meant they didn't actually need to have the kind of national lockdown that we've just been having.
I mean, in January, would we even have had the capacity, though, to pursue what you would have preferred, that option of a sort of South Korean style test and trace? Because we had a very, very limited testing capacity at that point, didn't we? And as we all know, it was also abandoned pretty soon afterwards, only to be reactivated again a bit later.
Well, I think the answer is we didn't have that capacity. But, nor were ministers advised to ramp up that capacity. And when we did decide to ramp up that capacity at the beginning of April, Matt Hancock had his famous 100,000 tests a day target. That will be seen, I think, as a turning point in our battle against the virus, because we got that capacity in 4 weeks flat in place. And that is why, because that now is being increased to 500,000 tests a day, that is why I think we can look forward to the autumn with a degree of cautious optimism that we won't have to go into the kind of lockdown that we've just had to come out of.
We'll come back to that, but I do just want to come back again one more time to this point that people may be listening to this and saying, well, in the end, it is the government, it is the ministers who look at what's happening and make the decisions. And people might say, it's a bit too easy to say, well, the scientists gave us the wrong advice and therefore we had to follow it.
Well, I don't point any fingers at individual scientists. I think that, if I look at my own time as health secretary, that's a better way of thinking about it, Andy. We did a 3-day exercise in 2016 called Operation Cygnus. The results of that exercise weren't published. There was actually no interest in this at the time. No one was interested in pandemics. But they have actually been leaked to The Guardian, so everyone can see what the conclusions were from that exercise. It was a very comprehensive exercise. As I say, it took up 3 days of my time, and I was, we were very absorbed in it. But if you look at those recommendations, there isn't a single recommendation to expand the PPE stockpile. There's not a single recommendation on testing at all. It's not even, it's not mentioned as a factor. And that is because the mindset was flu. And in flu, you really don't have the time to test and isolate people because of the way it spreads so quickly. And, we were ranked fairly soon after that by Johns Hopkins University in America as the second best prepared country in the world for a pandemic. And the top prepared country in the world was America. And the United States and the United Kingdom are two countries that, have actually clearly not had the most optimal responses. And that is because of this groupthink around flu as being the playbook we should follow. And that, I think, that was a groupthink when I was there. And I think with the group that we've still had in January.
Sorry to interrupt, Jeremy, but so how do we get around that groupthink? How do we make sure that we don't get stuck in that again?
Well, it's a very important point, and that's why I think publishing the advice that the scientific advice that ministers are receiving is important. That's why I think it's a concern that this week we discovered that SAGE doesn't appear to be meeting at the moment. I think it doesn't appear to have met last week. And in fact, the government seems to be migrating scientific advice to now come from the Joint Biosecurity Centre. And we don't know what the advice is that ministers are getting. And I think that would be something that would help avoid some of the things that have gone wrong.
So are you worried it's still a bit too secretive then, this advice?
Well, I think that's the problem. If the advice is secret, then you have a risk that if mistakes are made, no one points it out. And we have a superb scientific base in this country. I mean, it's one of the best in the world. And we should use it. We should get that advice out there. And the example I sometimes give is the problem of inflation that we have had in this country over many decades. But in 1997, we made the Bank of England independent. We set up a monetary policy committee. And the advice that is given on interest rates by the economists on that committee is made public. And we even know which economists have argued for a change in interest rates and which haven't. And so there's a tremendous amount of peer review by economists as to whether the Bank of England is getting it right or wrong. And I think that improves the decision-making process. And we have not had a problem with inflation as a country since then. So that's why I think in a pandemic, we should be more transparent, yes.
Okay, so Jeremy Hunt, you were Health Secretary for 6 years. Do you think the Health Service was left in a good state to be dealing with something like this? I mean, you must take responsibility for a lot of where the NHS was at the beginning of this. Do you think it's been in a good state to deal with this?
Well, we went through an incredibly difficult period of austerity. We had the largest financial crisis that we've had since the Second World War. And I was very aware during my time as Health Secretary that we didn't have enough capacity in the NHS or the social care system. And that was why I pushed through a 25% increase in the number of doctors and nurses and midwives that we train in 2016. That was the biggest ever single increase in training places. And I negotiated a 20 billion rise in the NHS budget as one of the last things I did as Health Secretary. I wanted to do the same for the social care system. But my priority as Health Secretary, I dealt with a number of scandals. I think you interviewed me about many of them, Andy, places like Mid-Staffs and Morecambe Bay and Southern Health. And my priority was to deal with the large number of avoidable deaths and the large amount of avoidable harm in our system. We found out that we were having about 150 avoidable deaths every week. And I discovered as Health Secretary, this is not just an issue in the NHS. This happens in healthcare systems all over the world. Because when you have a tragedy and a patient dies because of a mistake, it's incredibly difficult to be open about that. Because lawyers get involved, people are worried about their professional reputation, they're worried they might get struck off the register. And the single most important thing that needs to happen, which is you learn from mistakes, which is what I'm talking about now with coronavirus as well, is the thing that doesn't happen. So there's lots more progress that needs to be made on patient safety, but I was very proud that by the end of my time, 3 million more patients were using good or outstanding hospitals. So I think we've started to turn that corner.
You also, in your time as Health Secretary, memorably had a big dispute, a big fight with junior doctors and staff in hospitals. I mean, seeing how they have performed over the last few months, do you feel a little bit humbled by what you've seen after you went through so much in the dispute with them?
Well, I think we all feel humbled by the extraordinary dedication that we've seen by people on the front line in both health and in the social care system, and very literally putting their lives on the line to keep us safe. With respect to that dispute, you can't pick your battles in politics, and I could point out that there don't appear to have been any problems with that junior doctor's contract that was so contentious. But the truth is, I wish it hadn't happened, because junior doctors are an amazing group of people. They're very dedicated. They're the future of the NHS. And for the key messages that I wanted to get across about having a more open and transparent culture, so that we can reduce the high number of avoidable deaths that we have in healthcare and improve patient safety, it was obviously much more difficult to get those messages across in the context of a dispute over contracts.
But a number of those people, obviously, who are on the front line will probably not have a very happy memory of your time as health secretary. I mean, now, of course, we're all tremendously grateful to them. How does that make you feel, sort of contemplating that at this point?
As I say, you can't choose your battles in politics, and I was put in a very invidious position because you had this amazing group of people, but you had their union, which, incidentally now I have very good relations with the BMA, but at the time their union was telling them that this new contract will mean your pay is going to be cut between 30 and 50%. And that just wasn't the case. And no health secretary, me or anyone else, faced with that kind of messaging can give in, because it was just wrong. But even though I was successful in the dispute, in the sense of the new contract did become the contract that junior doctors operate under, I regret that it happened. I wish we could have found a way to avoid it. In practice, once they're balloted for strike action and had that 98% support for strike action, it was very, very difficult to see how it could have been avoided, but I do sincerely wish it hadn't happened.
It's about a year since you took on Boris Johnson and lost in terms of the leadership. He's the Prime Minister. Is he the leader we need right now in a crisis like this? What do you think?
Well, it's exactly a year today that the leadership contest was concluded and the result was announced. And it was a year tomorrow that Boris Johnson took over from Theresa May as Prime Minister. And I think you have to have a sense of perspective before you rush to a hasty judgment on how well the last year has gone. I mean, this time a year ago, we were looking into the abyss as a country. We were completely polarized by the Brexit issue, and we had the risk of the most hard-left Labour government that this country has ever had in its history. And, for me as a Conservative, this was an incredibly worrying period of time. And Boris made two promises in that leadership campaign. His two central promises: get Brexit done and defeat Corbyn. And we have left the European Union, and the Conservatives have an 80-seat majority. Now, I appreciate not everyone voted for the Conservatives, but I would just say this: how much more challenging would a pandemic have been if we'd had to face it with a hung parliament? We do at least have political stability. I think that's a very, very important thing when you face an emergency such as the emergency we've faced.
What about the way he's managed this, though? What would you look at and say, Prime Minister, I wish you'd done that differently? There must be things that you think, that's not the way we should have done it.
Well, we've just been spending quite a long time talking about those, Andy. And, indeed, as chair of the Health Select Committee, although I am a Conservative loyalist, I have a constitutional duty to hold the government to account in a completely non-party political way for its approach to health and social care policies. So I'm very open on those issues as to where I might have differences with government policy. And we've just talked about the fact that, we should have done more testing earlier.
I can put it this way. What about his leadership? What about the figure he cuts up there, or whether it's when he's shaking hands, when he's not wearing masks, the messaging? There's a lot of people who say, this is a man of certain qualities that aren't necessarily fitted to this particular moment.
Well, we didn't get everything right in our pandemic handling, but Boris is someone I worked very closely with when he was Mayor of London and I was Culture Secretary, and together we were responsible for the 2012 Olympics. And we saw then that he has an infectious ability to cheer people up. He was a fantastic salesman for London. And as we now enter perhaps our most severe recession of the post-war period, most severe recession in our lifetimes, Boris may well be the person who has the qualities that can lift the country's morale and help us get out of a recession quickly. And so it may be that those qualities come into their own. And certainly as we embark on a new set of relationships with countries around the world post-Brexit, Boris is someone who's shown that he is able to boost morale and boost spirits and give people confidence. So those qualities may come into their own.
Yeah, it's amazing how often, though, with all respect, people fall back on the idea of him being a booster and raising morale. What they don't talk about is a forensic brain or going into the details and being across the brief. I mean, don't we need a little bit of that right now?
Well, having been in the cabinet for 9 years and looked close up at that role of Prime Minister, indeed a role that I wanted to do myself, that is a role that exposes your character, the good, the bad, and the ugly. There is so much scrutiny. It matters to every single one of us who are Prime Ministers, because it's part of our identity as Brits. And so, your smallest flaws get found out. And all I would say is that I think that people do understand that about Prime Ministers. I think what you have to do is surround yourself with people who have compensating virtues. And, you can see with someone like Rishi Sunak as Chancellor, very experienced cabinet minister like Michael Gove, someone like Matt Hancock, who's been extremely resilient through the coronavirus pandemic, that, Boris does have the makings of a good team around him.
We've got a little time left. I just want to look forward. Do you expect, with all the evidence you've been getting at your committee and what you've been looking into, would you expect there would be a second wave?
I think that look, I'm not a scientist, so I can only talk about what the scientists are saying. And I think that they are very clear that there will be a spike in the autumn-winter period. Now, whether it's a second wave or isolated local outbreaks, it's impossible to judge. No one has a crystal ball on that. But the reason that we need to be very concerned about it is that, as we've heard from the Academy of Medical Sciences report a couple of weeks ago, at the moment in summertime, typically around 100,000 people have coronavirus-like symptoms, coughing, temperature, so on. In wintertime, it's 360,000, nearly 4 times as many people, because we cough and splutter and have our colds and so on at wintertime. And so we need to make sure we know when that happens who has coronavirus and who has flu. And that's why we need to have a big expansion of testing capacity. I think that we need to be testing everyone in the NHS every week, because healthcare settings are one of the key areas that the virus can spread. And we heard this week on the Select Committee evidence from Sir Paul Nurse of the Crick Institute that in some hospitals, 45% of staff were infected at one stage. So they are the most dangerous places. We've introduced weekly testing for care home staff, but we need to do it for hospital staff as well. So I hope we will do that. And what that should mean is that if we have a spike, we can have localized lockdowns quickly. And the hope is that will mean we avoid a national lockdown. But the answer to your question is we do need to worry. We are absolutely not out of the woods.
I mean, is it going to be possible to have those localized lockdowns? Because we're not getting to all the people we need to get to for tracing, are we? We're well below 80%. How worried are you about that? I
am concerned. The truth is, at the moment, because this is, the evil genius of this virus is that there's an awful lot of asymptomatic transmission. And what that means is that, the people who test positive, we are getting the vast majority of those into the test and trace system. But there are an awful lot of people who are catching the virus every day that we don't find out about. And overall, we're only feeding about a quarter of the people who get coronavirus every day into the test and trace system.
I mean, sorry, a quarter of them, that is a terrible low figure, isn't it?
It is a very low figure. And the only way that you're going to address this is by much more mass testing, because you've got to catch the people who who are asymptomatic. And that means mass testing of healthcare workers. It means mass testing of care home workers. It means mass testing of people like taxi drivers who are particularly high-risk group. And it might mean mass testing of cities like Barnsley, Bradford, Leicester, wherever we think there's a localised spike as well. But we are going to have to get into much more mass testing. Tony Blair goes even further. He thinks we should be testing the whole population every week. And I think we should be looking at whether that kind of thing is possible, because that is the way that we'll get this virus under control.
Do you think the country could take another national lockdown?
I think if we have to, we will. But
you don't think people have just had enough? Just the idea of ordering everyone back into where we were in the middle of March, is that really feasible?
I think when it comes to health and saving lives and the risks to higher risk groups, BAME groups, older people, I think we would pay that price if we had to. But I think we would do it with a very heavy heart, because the risks, in terms of the risks, are not just health risks, they're economic risks. And the people who pay the heaviest price, ironically, are not the people who suffer most if they catch coronavirus. It's younger people who have jobs in the hospitality industry, in bars and restaurants and hotels, who are seeing their future taken away. So that's why it can only ever be a last resort. Final question. You were Health Secretary through many winters. How worried would you be with the idea of going into another winter with the potential of another wave coming through? Well, winter is really tough for the NHS. It's certainly tough for the Health Secretary, but it is really tough for the NHS because if you're over 80 and you show up in an A&E department over winter, there's an 80% chance you'll end up having to be admitted to hospital, and it's hugely challenging. So what the lesson from that is that what you do in August, September and October that is absolutely critical, because by the time you've got to November and December, it's really too late to make big changes. It tends to hit the NHS in the new year, January, February, March, for various reasons. But it's what you do in the 6 months ahead of that really matters. So, I think everyone is heaving a bit of a sigh of relief as the virus is on the wane at the moment. But unfortunately, we can't let our guard down. Jeremy Hunt, thank you very much for talking to us for this edition of How Did We Get Here? And have a healthy summer and beyond. Likewise. You too, Andy. Thanks very much. Thank you.
Jeremy Hunt reflecting on what the next months may bring. If you have thoughts on this or ideas for any other podcasts, you can email me on andy.bell@itn.co.uk, and I'm tweeting at @AndyBell5News. Thank you for listening to this edition of How Did We Get Here? There'll be another soon.